This is Dr. Alex Hall coming to you from home in Menominee, Wisconsin. I'm a physician and a lecturer at the University of Wisconsin-Stout, and a lot of people have been asking me for information about how actually do you catch coronavirus, and more particularly, are they at risk of catching it? This is a little different from the risk of getting severely ill. If you do get infected, this is actually what's your risk of getting infected. So let's talk about it for a little bit. So first of all, about COVID-19. So we have this new coronavirus that is circulating in the world and has now become widespread. Coronaviruses are a family of viruses. There are lots of different types of coronavirus. Some of them cause mild infections like cold. Some of them have been circulating among our population for a really, really long time. We get them often. And then there are some other ones that cause more serious infections like SARS or MERS that you may have heard people talking about that can cause some really severe illnesses with some high mortality rates. So now we have this new coronavirus that we've never seen before, right? This is a new player on the world stage. It's a dangerous combination because it's what we say is highly transmissible. That just means it's really contagious. It's easy for it to be spread from one person to another. It also causes severe illness. In fact, it looks like it's probably on the order of about 10 times as severe as influenza, which, as you know, already causes tens of thousands of deaths per year in the United States alone. So this is more dangerous if you get infected, and you're more likely to get infected because it's more contagious. Add to those problems the fact that our population is completely vulnerable to this new virus. It's totally new. So we have no existing immunity. None of our immune systems have ever seen this before. We're completely vulnerable. And at this point, we don't have any effective vaccines or treatments. Scientists and doctors are working really, really hard and conducting lots of different trials to find medications that will be effective. At this point, none of them have been documented to be highly successful, but it's still the very early stages. That doesn't mean they won't be. And we're working really quickly on vaccines, but it's probably a year or two or more out till those are widely available. And we'll have to see how effective they're going to be too. It takes time to figure that out. So we're in a really unprecedented situation. So how do you catch this virus, right? How do you actually get it? Well, in infectious disease speak, there are two main ways to get it. The first is what we call direct transmission. This is associated with the highest risk of getting infected. So people who have the virus, they have, when they sneeze or cough, they send out respiratory droplets into the air. If you are directly exposed because you are near that person or you live in very close quarters with that person, that puts you at very high risk of catching the infection yourself. Now you may say, well, wait a minute, I know about somebody who there was no sick person that they knew. Well, sometimes with this virus, it's looking like some people can be contagious without even having symptoms, without feeling sick, right? That's part of what makes this virus so effective at being spread, is that you can't really tell all the time who has it and who doesn't. The other way you can catch it, as opposed to direct transmission, is what we call indirect transmission. So if you touch something that has somebody else's infected respiratory droplets on it, so here's a door, let's say their door handle has some infected droplets on it from an infected person, you touch that door handle, and then you touch your face, well then the viral particles in those respiratory droplets can get into your nose and mouth, or maybe even your eyes, and then cause infection in you. So those are the two main methods that you can catch it, direct and indirect transmission. Direct transmission has a much higher likelihood of infecting you than indirect, but both are possible. So how do you prevent catching it, right? How do you not catch it? Well, in order to prevent direct transmission, if you stay 6 feet or more away from any other person, away from anyone who might be infected with the virus, that will significantly decrease your risk of getting infected. Now, it's of course not foolproof, however, and so the best thing to do is to just stay home. Then you know you won't be coming into direct contact or close contact with somebody who's infected, unless they're already in your family, and then that's what are we going to do, right? So the other thing we do is prevent indirect transmission. So if you are out and about, right, you want to wash your hands for 20 seconds or longer with soap, making sure you're getting all surfaces of your hands before and after touching anything that is a commonly touched surface. You also want to not touch your face. But the best thing you can do to prevent indirect transmission is to stay at home, because then you know you won't be touching any potentially contaminated surfaces. So when we think about risk, your risk of getting infected depends on how much direct contact you have with people who have the infection, as well as how much indirect contact you have. So our people who have the most direct contact with infected people are our healthcare workers. So that's why you're seeing a lot of news stories about the need for PPE or personal protective equipment, things like masks and face shields, right? These are the people who are suctioning out the mouths or breathing tubes of infected people, who are peering into their throats or their eyes or their ears, right? Our healthcare workers are, by definition, if they're caring for someone or if they're a caregiver, they're in close contact with infected people. Then, of course, we have the close context. So household members, family members, people who have been very physically close with infected people because they have high direct contact. Then kind of moving down the list in terms of your risk of getting infected would be if you're a casual contact of somebody who has COVID-19. Maybe you say hi to them at the office water cooler, right? So you have a little bit of direct contact, but mostly maybe just indirect contact in terms of the handle on that water cooler. And then below that would be shared spaces, right? So maybe somebody in your office gets diagnosed, but you never really saw them much to speak of, but maybe you used the same microwave in the lunchroom, right? So shared spaces. And then the lowest risk of getting infection would be if you're a contact of a contact, right? If you're like, well, my fiance works at the same office as this person who got diagnosed. At best, that's going to be indirect contact, so that's going to be some of the lowest risk folks. But you notice here that all of these people are potentially at risk. It's just a matter of degrees. At this point, we don't have widely available testing. So at this point, we're not able to test and screen everybody who's potentially infected. We have to focus our testing on the people where we really need to know so that we can care for them appropriately. So our healthcare workers, because we really don't want them getting sick, and if they are, we want to isolate them right away so they don't infect the rest of our healthcare workforce, and close contacts. Also severely ill people where we really need to know if this is COVID-19 or something else so that we can treat them appropriately. Those are also the people that we're going to be testing right now. In the future, our hope is that testing will be more widely available, and then we'll have a much better sense of what's going on in the community, and everyone would be able to get tested who has a potential for being infected. So what should you do? The safest thing is to stay home, right? So that's why Governor Evers put out this safe at home directive. So everyone who can stay home should be staying home, because you won't be coming into contact with an infected person or potentially infected and contaminated surfaces if you're staying at home. If everybody could stay at home for 2 to 3 weeks, this virus would completely peter out eventually, right? Unfortunately, not everybody in our society can stay home, right? We have essential workers, healthcare workers, safety workers, food supply workers, grocery workers that we all need so that we can survive, right? So it's up to those of us who can stay home to do so as much as possible to protect those folks who have to go out. So what should you do? You should stay home. And what that means is no visitors. You're not having dinner parties. You're not having people over to play cards. No in-person socializing. I know some people are taking to every day going out to the ends of their driveways and sitting in chairs at the ends of their driveways and talking to their neighbors across the street. That's fine, but you want to stay as far away as you can. And it means that when you must go out, try to minimize those trips. So if you can, only go to the grocery store once a week or once every 2 weeks if you can, right? We want to minimize how much contact, both direct and indirect, there is between people. If you must go out, then you're going to employ all those strategies we've been talking about. So you're going to stay 6 feet away from other people as much as possible, good hand washing before and after touching surfaces, and don't touch your face. So what if you think you've been exposed? What if you heard that John down at the plant tested positive and you actually maybe used the same break room as that person, right? So what do you do if you think potentially you've been exposed? And this is going to become more and more of a concern as this disease becomes more widespread in our population. So if you are a close contact, so one of those people at high risk of getting sick, you will be notified by your local health department and given instructions. That is their job. It's called contact tracing. They're really good at it. They've been doing it for years behind the scenes. You just maybe haven't known about it for other conditions. And so what they do once someone is diagnosed is they're going to find out who are all the people that they've been in close contact with during the period of time during which they were potentially infectious or contagious. And they're going to call you, they're going to notify you and give you specific instructions. If you are not a close contact, right, so you're maybe a casual contact or you share spaces or you're a contact of a contact, right, you're a couple of degrees removed, then you're not going to get a phone call, but we're going to ask you to just be prudent, right? So stay home if you can. Keep an eye out for any symptoms of illness, things like fever or sore throat, cough, shortness of breath. And if they're mild, you can stay at home, use over-the-counter medicines as needed to treat your symptoms. But if they become moderate to severe, you're going to want to call your doctor and check in with them about any medical care you might need. So there's no specific treatments yet for this virus, but sometimes we need to support people with extra oxygen or by breathing for them. And also to decide whether it would be appropriate for you to get tested. Right? So have you kind of fallen into that higher risk category, higher likelihood category of having COVID-19 that we're able to use one of the tests that we have to find out if that's indeed what is making you sick. If you absolutely cannot stay home, again, good hand washing, stay 6 feet away, and you're also going to want to disinfect any common surfaces. So if there's one staff bathroom at work, you're going to want to have some disinfectant wipes to wipe down the toilet handles and the sink handles and the door handles and the stall lock handle things, any things that a lot of people are going to be touching. So I hope this has been helpful. The CDC has set up an excellent website, www.coronavirus.gov, with excellent information and graphics about all of these things I've been talking about and lots more. So please visit their website and please, if at all possible, stay home. Thanks everybody. Stay safe.